with Renew Concierge Physical Therapy, and today I'd like to talk to you about abdominal bracing. It is the foundational exercise that you're always going to need to have in order to have a proper and appropriate stabilization protocol for your low back pain. And so today I have Diana here. She's going to help me with demonstrating what this looks like, although you're not going to see too much if she does it properly. So go ahead and lay down, Diana. So with abdominal bracing, one of the most important things to realize is that timing is more important than your strength. The research shows that if you're really strong, but you're not really getting good timing with your exercises, you're not going to be very good at keeping your pain levels down. Okay, and so with abdominal bracing, there are three main muscle groups we want to be considering: the erector spinae, which is your lower back muscles, your transverse abdominis, and then also in your oblique and abdominal muscles. Okay, so there's really three muscle groups that have four muscles involved, and if we can concentrate on all four of those, we'll have the best results. And so with Diana here, what I'm going to have you do is put your hands behind your back. You're going to feel that spine here, and then you just go just to the side of it, and you're going to feel the mushy muscle, okay? And I always recommend not putting your hand like this, but like this. It's a little bit harder on the shoulder, but if you do it that way, you can actually feel the muscle contract, which is really what we're going for. And so, Diana, go ahead and engage those muscles. Now, do you feel anything? Probably not. Okay, and that's very normal. Okay, that's why you come to a physical therapist, is to learn how to engage these muscles that you probably aren't engaging. So if you put your hand on the spine, go off to the side, and you try to tap those muscles, they should feel mushy. Okay, you shouldn't be real tight. And then if you press up and try to engage those muscles, if they don't, that's kind of normal. That's why you're watching this video. What I want to do is give you some tools to learn how to activate those muscles. And so what I want you to do, Diana, is I want you to push these heels down to the bed. Okay, just push real down. Now, does that pop out at you? Mm-hmm. Now, what should happen is the muscles should pop out, and you should feel them tighten. If you're doing that, then you're on the right track. Okay. With abdominal bracing, we want those lower back muscles to engage, and this is the best way to activate those. Your job is to learn how to activate the muscle without your legs. The legs are a crutch. They're a tool, not necessarily the exercise. So, Diana, what I want you to do is engage, hold for a couple seconds, probably not there, then relax. Now push down, and you go, yeah, that's what it's supposed to feel like. Okay, now relax. Now go again here, engage, and you might start to feel like maybe they're coming on a little bit. Now relax. Push down again. And so what you'll do is you'll bounce back and forth, okay? Another thing to consider is tapping your muscle when you're down there. So you can kind of just push, push, poke, 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 and what you'll do is you'll get some activation in those muscles as well. We call that facilitation. The last thing we want to encourage you to do is engage your tummy muscles too. So you can have one hand in the back and one hand in the front. And so what you're going to do is you're going to find that pelvic bone right here on the front. You're going to go just up and in and right there. So Diana, you should be able to engage your muscle there. Now, do you feel that? Mm-hmm. Now, Diana can do that, but if you can't, go ahead and lift your head up just a bit. Boom. Mm-hmm. You can feel it. Just like you push down here, you want to lift up just a little bit to feel that muscle engage. If you engage the front and the back, you should be getting those obliques. You really can't do it any other way. So, moving forward, your goal with the abdominal bracing at this point is to be able to engage your core independently of all other movements. Okay, and that's a really hard task. A lot of times, for example, so go ahead and engage your core. All right, now it's nice and tight, but if I lift the leg, she's very stiff. And so what she's doing is she's engaging her core, but not independent of her legs. And I should be able to rock her legs and jelly, 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 but she's really not letting me. And your job with this exercise is to engage the abdominals, the low back muscles, all independently of all the other motions going, all the other muscles going on around them, okay? So try this at home, 3 seconds to 5 second holds, 3 sets of 10 a day, just working on getting your timing and your disassociation from other muscle groups going. This is not to get you stronger, although I wouldn't be surprised if you felt pretty tired and actually pretty sore from this exercise, especially if it's been a long time since you've been activating your core. Again, my name is Dr. Dave with Renew Concierge Physical Therapy, and enjoy the rest of your day.